This is April Van Buchen, and the concept we will be covering in this voiceover recording is evidence-based practice. I'll let you read the definition of evidence. Evidence helps us prove or disprove a conclusion. It's just like the legal system. So it gives us a guide of what to do. It establishes what was right and what is wrong. When you're dealing with the field of health and sciences, evidence helps prove whether there's benefit or harm to doing something. So it helps to drive best practices in healthcare. You'll hear a lot of your professors talk about the evidence shows, or that's evidence-based practice. Evidence-based practice should drive every change in healthcare. There should be research or studies that prove something is effective before you just willy-nilly change a process. Evidence-based nursing has been defined as the conscientious, explicit, judicious use of theory-derived, research-based information in making decisions about care delivery to patients. And consideration of individual needs and preferences should be paramount. So evidence-based practice could be your experience as a nurse or provider. It could be research that you have performed on a topic. And it should be very clearly defined. This is what we did, and this is the result of it. In nursing, especially say you're at a magnet hospital, where best nursing practice has won you the award or the status of being a magnet hospital, every change you make is supported by the literature or the evidence. And we want you guys to leave this program understanding what evidence-based practice is and how to identify the evidence. It is so important that it's one of your concepts that you need to be very comfortable with. Interrelated concepts to evidence-based practice are things like health policy, safety, informatics, economics. The exemplars that support the concepts of evidence-based practice are research studies, practice guidelines, expert opinions, there's a great need for evidence-based practice. Evidence-based practice integrates the best current evidence with clinical expertise, the needs and preferences of the patient and family. Evidence-based practice considers the values of the patients and family and puts it all together to deliver the best patient care. Evidence-based practice requires teamwork, collaboration. It requires all that stuff, but it requires research. That's the biggest thing. You have to know how to find something to support why you're doing it. A good argument. That's what research is. You can use it as an argument. We want to make a change. What we're doing isn't working. The first question that healthcare leadership is going to ask you is, what is working? What would you like to do? Is there any proof that supports it works anywhere else before I go out and buy this equipment or before we let you change your practice? Where's some proof that it might work here? And you either do your own research, you collaborate with experts who say, hey, that might be a good idea, and you have them for support, because that's still evidence, right? Or you research a scholarly article where someone actually did formal research and proved that whatever you want to do works. In order to do the research or change of practice, you have to cultivate a spirit of inquiry. And a spirit of inquiry should follow you in everything you do as a nurse. It should make you interested. It should make you want to make something better. So you have to ask questions, and you have to understand the scientific method, which is the foundation of research. It is the most reliable means of acquiring and conducting research. and it is objective. So we have subjective data, which is what I think, I feel, I'm making assumptions. I use my personal bias. Maybe I think older people are slow cognators, so I don't think they're very smart, so that's a personal bias. I'm making that up anyway, because I'm an older person. Or I think people who aren't college educated may not understand this, so that's subjective, right? They're my own personal bias, thoughts, prejudices, everything. In healthcare, and when you use the evidence, subjective stuff goes away, and you just use objective data. What I see, what I know, what is written down, what the patient tells me, it is the facts only. And that's what you use in evidence. Objective data, objective means of acquiring research. The scientific method is a step-by-step process that ensures the findings are valid, reliable, and can be generalized to a similar group elsewhere. So if I do a study at community colleges, I can generalize my findings to other community colleges, but depending on what I studied, I might not be able to generalize my findings to BSN programs. So if I'm doing a study on hypertensive adults, and I get the results on hypertensive adults, I may be able to generalize my findings to other hypertensive adults in a different part of the country, but I may not be able to generalize my findings between cultural groups, right? Or I may not be able to generalize my hypertensive findings to children because they're totally different. So generalize means take my results and use them in a different population or a different group. The groups have to be similar. So using the scientific method allows us to do that. So where do you get your evidence? From all these things listed. So from your book, so you guys are going to get your evidence from your book. You're going to get evidence from the teachers. You're going to go into clinical, and those nurses you see doing stuff, that's going to give you some of your evidence. You get evidence from experience. Physicians get evidence from experience. So here's an example. When I taught pharmacology last semester, the book says for stomach acid disorders, you're supposed to start with this type of drug. If it doesn't work, then you go to this other type of drug, and if it doesn't work, you go to this third type of drug. So there's kind of a hierarchy of what to start with. And I know that there are some physicians who just skip the first two drugs and go to the third one because over their course of working, their history has shown to them and given them evidence that the cost is the same, there's no injury to the patient, it's easier, faster just to go to that third gun, and the benefit outweighs the risk because they don't have to take time off to come see the doctor, and they aren't prolonged with stomach acid issues. This third one works all the time. So they just go to it. It doesn't mean they're wrong. It means their evidence-based practice has proven that to them. For nursing students, it's textbooks, it's reading articles, it's listening to the teacher until you develop your own practice that gives you evidence that stuff you always do that works. So you're gonna keep doing it until something doesn't work, or you read something that makes you want to change your practice. We want you always to read. We want you to always have a spirit of inquiry, and we want you to always use evidence to support changes. If you guys go to work at Winchester, they're a magnet hospital. They are a magnet hospital means that they have a level of nursing expertise and leadership, and when they make a change with anything, it is supported by evidence. Every nursing change should always be supported by evidence, but it's really clearly identified in a magnet facility, which is kind of cool. Okay, so we talked about where you get the evidence. One of the primary locations that you get evidence is in a research article. And so many people look at research articles and go, holy smokes, this is too complicated for me. I don't know I don't know where to begin, and I don't understand some of the words. So I'm going to give you some of the components of a research article, because it's a wonderful way to identify new knowledge, to improve professional education and practice, and it's just a really great resource if you're confused about something or why something is done. So the abstract is a summary of the whole article. It sums it all up. So read the abstract first, and that tells you if the article is on the topic that you want to finish reading. Do you want to read all the details? If you're looking for something dealing with diabetic foot care in a aging population, and you Google or you go to your nursing resources, CINAHL, EBSCO, ProQuest, and the library has some nursing resources for you. So if you go into any of your nursing resources and you look for scholarly articles on diabetic foot care for the elderly, you're going to get all kinds of stuff. So you might get diabetic foot care, and it might be a pediatric patient. So when you read that abstract, it tells you whether you want to finish reading or not. So that's your first start, okay, of reading a research article. The introduction will tell you what the population was. Is that population similar to what you have on your unit? So elderly adult, diabetic foot care. This population is, might be an article done in a totally different country with a different type of unit. So it's not very similar to yours. So you might want to move on and find another article that is similar to your location with the same kind of people. Are you following? A little bit, but if it's pediatrics, you don't want to look at it. If it's some totally different country that uses different supplies, you maybe wouldn't want to look at it. So you want to find something close to home. So, and then you can go to the very bottom of the article and read the conclusion. What were the outcomes? Did it do what you're hoping? Did it help support the change that you're hoping? If it did, finish reading the article, and maybe you can identify the change that they made to show improvement that you possibly want to suggest or could possibly give you insight on what you should do on your unit. I love research articles. Most people don't like, I don't like reading all through them. I don't. I know where to go. I go to the abstract, the intro, the end. If it fits what I'm trying to learn about, then I'm going to read the rest and understand the details and find out, what did they do in this research? So be sure to do that, or you'll be reading pages and pages and pages of stuff. So research articles are used by many professionals, many specialty nursing organizations to support advancing nursing science. So now I'm going to give you some definitions. Okay, so research is performed to answer questions, to solve problems, and to contribute to the knowledge base. Many hospitals have research departments. They try to understand why. It may or may not improve patient care, but it helps them understand stuff, okay? Evidence-based practice is using the information from research and other sources, the clinical experts, right, those are the other sources, to determine safe and effective nursing care with the goal of improving patient care and outcomes. So evidence-based practice uses that research, but their ultimate goal is to improve patient care. Then there's quality improvement. Quality improvement utilizes research. It improves local work processes to improve patient outcomes and efficiency of the organization. So quality improvement also uses research. And they use research to improve outcomes and to make the system more efficient. Got it? The attribute of the evidence that you would use in evidence-based practice would mean, like, I can replicate it somewhere. So maybe there was a study that was done in an ICU setting dealing with how to perform urinary catheter care. And I work in a med-surg floor. I'm going to replicate that study on my med-surg floor to see if I have improvement like they did. So evidence, a positive attribute would be you can replicate it. Then it's good evidence is reliable. You can do it across the same population for similar disorders, and you have similar outcomes. It's valid. It's accurate. I take that evidence and I perform the work, and I can validate it. I don't take that evidence, perform the work, and realize it doesn't work here. Everything's the same and it still doesn't work. That means it's not valid. So when we think about evidence-based practice and people that have used evidence, I want to bring you back to the first nursing theorist, Florence Nightingale. Florence Nightingale used evidence. She used infection rates to help prove her point, to improve the hygienic practices of the war hospitals in the Crimean War. So she collected data on all the infection rates and said, hey, they don't have clean water. The hospital is above a sewer. They don't have fresh air. There's too many people crammed in a small space and there's no fresh air. If we can get them fresh air, if we can get them clean bandages, if we can get them fresh water, I think that the infection rates would decrease. And guess what? It did. So she was a pioneer in hygienic practices and the first nursing theorist. She started the first hospital. She started the first nursing school. But all of her work is supported by evidence. People who use evidence are people who change policy. Policies are regularly looked at, and evidence is regularly compared to the policies to make sure that they're current. Committees have to approve any changes, and so there's experts on the committees that help approve changes. And if you have any practice problems, you look at the evidence. I'll give you an example. On the orthopedic floor at Winchester Medical Center, there was a problem with the patients not being able to sleep at night at all. They couldn't sleep. And so the nurses didn't know what to do. So some of the nurses did some research. They looked at articles. They said, what do other hospitals do? What do other nursing wards do to help prevent the patients from staying up all night, giving us poor satisfaction scores because they can't sleep? And some people, have signs to keep the noise down, make everybody be quiet. And some hospitals use white noise machines. And so these nurses pulled the evidence and said white noise machines seem to be very effective because we can't control the people or the admissions or the discharges. Let's get some white noise machines and see if they work. So they did. They used evidence to support a request of funding to get a product that they needed to make their patients happier, to make their patients sleep all night. And if they sleep all night and they're happier, they get better quicker, correct? So finding answers to a practice problem. If they had a problem, they used evidence to find the answer. And they used evidence-based practice because they incorporated a change based on that evidence. It's just really fascinating. I could go on and on, but I'm finished talking about evidence. Just know it needs to drive everything that you guys do. Thanks.